Hi, my name is Jasenia Figueroa, and this is my oral presentation. Ethics is the moral principles that govern a person's behavior or the conducting of an activity. Some important features of ethics that I've learned in week 2 was the Socratic method, which was a method of questioning, a way to teach, and finding the truth. This is a way to find out what seems most right. I also learned that there are different types of ethics. One being descriptive ethics, which is the scientific study of moral beliefs and practices. This depicts and clarifies moral opinions and practices. For example, what does Group X think about the morality of abortion? This would be an example of descriptive ethics. Another example of ethics would be normative ethics. This is the study of the principles, rules, or theories that guide our actions and judgment. It also involves developing actions, guides to direct ethical behavior. An example of this would be, is aborting a fetus ethically justifiable? Now for another example of ethics would be metaethics, which is the study of the meaning and logical structure of moral beliefs. Rather, metaethics involves analysis of the language, concepts, and methods of reasoning in healthcare. An example of this would be, what does ethically justifiable mean? An understanding of ethics will help me with my major and career by ensuring moral and social values such as human rights, social responsibility, patients, and patients' welfare. I also will have to consider issues when advocating for patients and families, and on top of that, I must consider their own beliefs. My major is nursing. Another type of ethics is relational ethics, which is involved in healthcare. And this is the understanding of an individual not as autonomous and independent, but as a relational, interdependent being, and emphasizes relationship as integral to human existence and consciousness. Ethical caring, it would be not in terms of one person naturally caring for another, but one person caring for another because they believe it is the right thing to do. Now, knowing about the field of ethics and various historical ethical theories can help me in my future career by having an understanding and making the right decisions in different events that I may encounter. Trying to do what is right and good, doing the least harm as possible to the patients that I deal with, having respect for those who wish to make decisions that apply to their lives, their own lives. Now, health ethics is defined as being the branch of ethics that deals with ethical issues in health care, medicine, and science. It involves discussions about treatment choices and care options that individuals, families, and healthcare providers must face. Now, there are different types of examples of health ethics issues. One being making decisions about end-of-life care. This would involve the family, the patient, etc. Another example would be determining whether to allocate funds to the treatment of disease or the promotion of health. 3 would be critically examining the discrepancies in health status between populations and our ethical obligations to ensure equitable access to health services. Now, another example would be ensuring ethical conduct in health research. And 5 will be deliberating upon the ethical implications of genetic cloning technology. This was my oral presentation, and I thank you for watching. Have a nice day.